All right. Well, so we missed last month's, but it didn't feel like it because we had our summit. And so all of you guys joined us there. And we actually also had our on July 1st, we had our meeting where we asked about data gaps. So that was a really productive meeting. So we had a productive July. We just together like this. Oh, I see it. Isabel. Hi, Isabel. Come on in. So yeah, let's go ahead and just get going. We'll do some introductions. You know, we're here like we always are. I don't think we have anybody new, so I'm not going to tell you what we're here to do because we do it. We've been doing it for 13 meetings. But we are going to hear from Asamu today, and I'm excited about that. He's going to tell us about the tribal climate change program at CDPH here in California. And but before we do that, we'll do some member announcements. We were going to have Shabahu from HHS come to talk to us, but he actually asked not to talk in August. He wants to talk in September instead, which I'm excited about. I actually think this is a good back-to-back. We're going to hear from a state level public health department on what they're doing to support tribes in climate change and health. And then we're going to hear from the federal government, a new program. I think there's a lot of excitement around what they're doing, but I was actually hoping somebody from HHS would show up here today just to be able to hear what great things are happening at California, which I think has gotten a head start. But we'll see who comes. All right, so let's do some member announcements. Does anybody have anything they want to share? I've got a few things, but I'll let you all go first.
I guess one thing I could share, there's only a couple days. No, I think it closes the 15th. But Angie, I sent you, because I figured you have the full network connection. There's a job posted by the USDA for a tribal climate resilience, I guess kind of like a liaison program manager. And there's a bunch of openings throughout the country. I can send it around to this. If there's a good email to send it to for this group, I can just do that as well. But there's one open in Anchorage, one in Sacramento, and a couple other ones. And it is not open to the general public, but it is open to tribal members or other federal employees. And I think the requirements are pretty varied. So you could have a bachelor's degree with a bunch of experience, a master's degree with some experience, or a PhD. So it's cool that it's open to all. And so I figured this group might know someone who's looking for a job, but it looked like a really cool opportunity to interface with tribes and the government to work on climate resilience activities.
There's so many good opportunities right now. Thank you. And so you emailed that to me, right, Ben?
Yeah, I think maybe on Monday or so. So
yeah. Okay. You know, I think we're going to end up sending an e-blast out to our listserv pretty soon because there's just so much stuff seeming to happen. But that's a good one. That's a good one for us to share. Thank you for alerting us. The other one that I'm planning to share in a listserv is in California, the Office of Planning and Research is looking for tribal advisory group nominations for their tribal research program. So I'm going to get that out as well. What else, everybody? What else should we know?
Anybody going to NTIC? Probably not. Probably just me. The National Tribal and Indigenous Climate Conference at the end of the month in St. Paul.
It's a little sore subject for me there, Shasta.
Oh.
Thanks, though.
Sorry. Yeah. I'll be there. I'm not presenting on anything for once, but since I'm on ITEP's climate change tribal advisory group, I'm going to be moderating some panels, and I'm going to be the chaperone on one of the field trips, because apparently you need to chaperone people, but just make sure everybody gets on the bus and stuff. But I chose the field trip that's going to the sous chef. I don't know if you've all heard of the sous chef, but he's an indigenous chef. He's a Lakota, and he's got food places in the Minneapolis-St. Paul area. And we're going to go in and tour his stuff. I'm like, the food field trip? I will chaperone that.
It's really good.
Awesome.
It's shockingly good. I hope somebody does a field trip to go ricing, because that's really fun. It was too early in the year for me to rice when I was just there, but
I don't think that's on the list, but I might see if I can find a friend to take me anyway.
it's really fun and beautiful.
That's it. I got nothing else.
So Doug Cluck from NOAA is actually going to be there too. He was just writing to me and asking if I would be there. And I was like, nope, but I think Shasta will. So maybe if you see him, give a in-person hello.
Sure.
Shasta, do you want to say anything about the summit? I mean, I guess this is a good opportunity to just thank those of you who were part of it. So thanks. You were there. We don't need to say much unless you want to give us any feedback or any thoughts you've had in the meantime afterwards.
Just that the Paula team was, or whoever or organized that thing, you, Angie, was amazing in spinning that around in less than 24 hours and making it feel like you planned it that way forever.
You know, so Serena Vega is on the line here and she was part of that team. And there's another Serena who was really responsible for that transition. And she was a rock star.
Yeah. And so were all of you who were there and participated and helped us. So yeah, thank you, thank you, thank you.
You know, I'm realizing we have somebody that I don't know on the line here. Nikki, do you want to introduce yourself? I feel like we're talking amongst ourselves, but we might need to clue you in on what it is we're talking about.
Yes, I'm Nikki. I work with Isabel at Community Health Statistics at San Diego County, and I might be attending the meeting. I will be attending the meeting next month since she will be out.
Oh, right. Okay. Well, great. Yeah, we're here to talk about all things tribes, climate change, and health, specifically from a data perspective. So we just kind of do these member announcements first, and we just had a summit really diving into data. So the focus of that summit was on vulnerability assessments primarily. So a couple of things there is, doing that summit forced us to our next iteration of our easy tool. So the Tribal Climate Health's easy tool. So there's a new version of that just posted a couple of weeks ago. It's not going to be the final version. There's probably another one coming out in a few months, but I just wanted to say thank you to folks here, especially those that attended the July 1st meeting that we had on data gaps, because we've incorporated these new data sets that we've learned about into the easy tool. We're just continuously making it deeper, more robust tool, and we're going to continue to grab what we learned out of the summit as well, and have a new iteration probably, like I said, in another few months. But there is maybe Serena Vega, if you're there, maybe post the link to the new easy tool for anybody who wants to be able to access it.
Sure, will do.
Oh, and we have a new person here. Just want to make sure we get a chance to say hello. Hi, Patricia. I know you're getting on. Oh, she's connecting to audio. Hi, Patricia. Thanks for joining us. We were just doing our member announcements. But if you would like to say a quick hello and just introduce yourself, that would be great.
Sure. Yeah. Thanks for letting me join last minute. My name's Patricia Kennedy, and I work with the Office of Planning and Research. I'm working on California's 5th climate assessment and leading up the tribal research program. So it's the first time we're doing a tribal research program. It's based largely on the good work of the 4th assessment and the recommendations that came out of that. So we're just sort of in the first initial stages and embarking on a new program, and really happy to be here.
Great. Thanks for joining, Patricia. We were just talking about the tribal advisory group email that you had sent out. So we'll make sure to get the message out about that.
Okay, great. Thank you. Yeah, any questions, let me know.
So we kind of have a California group today. It's not always this way, but do you all know each other? Do you know Lori over at WEHA? Osama over at CDPH? And then we've got a couple of folks here from actually the County of San Diego. Okay, great. Well, we're glad you're here. We hope you continue to join us. Our point here is to mainly focus in on anything tribes, climate change, health from a data perspective. Okay, anything else? Yeah, I wanted to bring this one up just before we move into our featured discussion. So did anybody else see this? This came up today. in the research. Which journal is this? Nature something journal.
Nature climate change.
Nature climate change. Over half of known human pathogenic diseases can be aggravated by climate change. So they went through the process of looking at all the potential ways that climate change can trigger either an increase or a decrease in mainly an infectious disease. And there apparently is a lot of interaction there. So they're saying 58% of infectious diseases confronted by humanity worldwide will have been at some point aggravated by climatic hazards. So, I mean, for me, we've all got a big lesson in infectious disease over the last few years, knowing that climate change has a role, I think is important, just in predicting what's going to happen in the future. Asamo, you've got something to say here. Have your hand raised.
Oh, I don't know if, well, I was having some computer trouble, but I don't know if Serena mentioned that she and I both attended a really excellent training that I'm happy to just mention and plug for next year's cycle for anyone who's interested. It's called the Geocoding Health Disparities Project training, which was in the 2.0 version this year, and I assume will be updated again in the future. But this is a project of the Chan School, the Harvard School of Public Health, that they did online, and it was a really amazing, diverse group of folks. Didn't have a tribal specific focus, but they did talk about some helpful concepts. It kind of was like a statistical methods deep dive using R and doing different kinds of health stats and mapping for small areas, which I thought was pretty helpful for thinking about tribal data. And it is free. So I think next time that happens, definitely encourage people to sign up or to apply. And then there was a really strong California contingent. So there's a good chance you might be able to take it. Serena,
what agency provided the training?
The Harvard School of Public Health.
Oh, you said that. Okay. Cool.
Specifically, Nancy Krieger, who's a longtime researcher there. She did a lot of the kind of seminal studies proving that racism has health impact, that segregation has had health impact. She's just a really amazing person and has a whole fleet of really smart staff people who work with her. Serena Vega, did you have anything you wanted to add about the training?
Osama, I think you covered it. And one of the things that was interesting is there was a large amount of public health departments there, CDC employees there, asking the same questions that we're asking, and trying to figure things out in terms of data, making connections between public health and impacts, and also in the implementation phase, trying to figure out how to get all of this information into the hands of the community. So really interesting, and I would encourage anyone next year to apply. Cool.
Yeah, amazing. Good job. I'm glad you guys were there. And so, yeah, Serena Vega keeps sending me little things that she's finding, I think through that training, potentially help us add more things to our easy tool.
I want to just point out on Serena's behalf that we're using both of her names because we also have a Serena Sewer, and I need to keep them. We need to know which Serena we're talking about.
Yes.
I can see somebody watching this later and saying, this poor lady, she doesn't just get to be Serena, she has to be Serena Vega. If you had a name like mine, you could just have one name. I'm like Madonna or Cher or, dare I say, Beyonce.
You totally like Madonna. Anybody else have any announcements before we move to the next topic? Okay. Thanks, Isabel, for putting that link there. All right, so at this point, I'm going to put the link to that study just in case you all want to have access to it. But let's move to the meat of our conversation today. We have Samo, and he's here from CDPH. We all know him. He's been here, one of our regular members. But today we get to hear from his perspective what they're up to at CDPH to help tribes deal with the impacts of climate change. And so he's going to tell us all about their tribal climate change program. And then we get to do our normal thing, which he's going to give us an overview, and then we get to ask questions and have a conversation and learn more about just where it's all heading. How can we better and better help tribes access the data that they need to protect themselves? Okay, so do you want to go ahead and drive, Osamu?
Yes, I will share screen now.
Are you still a co-host? I'm going to make you a co-host again here.
Okay, it looks
There
like
we
I
go.
can kick you off if that's okay.
Yeah.
All right. Okay, I see the green outline, so I'm assuming folks can see that.
Yes.
Yes, so today I am going to I'll give a quick overview of our team and our activities, and then get into specifically our Chivi's platform, climate change and health vulnerability indicators for California. Yes, so I am Osamu Kumasaka. I use he, him pronouns, and I serve as the tribal climate specialist in the CDPH Office of Health Equity. And I'm speaking to you today from my hometown of Flagstaff, Arizona, which borders the Navajo Nation. I will talk a little bit more about our tool that we've developed, the Climate Change Health Vulnerability Indicators for California, which is an online visualization and mapping platform we've developed for those indicators. And I've put the link into the chat for anyone who wants to play around in it themselves. These are indicators, maps, and other information that can be used to help identify the populations and locations in California that are most vulnerable to the health impacts of climate change. But first, I'm going to give you a little background about our office and how these indicators are developed, and I'll do a short demo and tell you a little bit more about how the tool has been used and our lessons learned from that. So our team in the Department of Public Health, we call it CHESS, is a small but mighty team of 7 staff and usually a couple of fellows, and we focus on upstream policies, systems, and environmental change to assure that California's actions to prevent and prepare for climate change improve health equity. Here's our mission, and we work with mostly kind of historically, I've worked across agencies and departments to make sure that what California is doing is preventing and preparing for climate change, but also improving health and increasing equity. We consult with a lot of other state agencies on their programs, plans, and policies. And we also engage with community-based stakeholders to elevate their voices and increase their decision-making power in state climate change efforts. This is a graphic that we've adapted from the CDC, which just shows the range of human health impacts that we're seeing across the state. And we try to prioritize the human health impacts of climate change, and also those who are going to be hurt first and worst, those without housing, low-wage outdoor workers, communities of color, those who are socially isolated, and people with physical and mental disabilities. We more recently have been working to increase the capacity of local health departments, tribes, and tribal serving organizations in planning for climate-related health impacts. And we do this by providing technical resources and tools to support their efforts. And we also encourage their participation in state grant programs and other funding opportunities. So we provide data, research, and tools, including our CalBrace, California Building Resilience Against Climate Effects, Climate and Health Adaptation Toolkit. My role specifically on our team is to support tribes and provide technical assistance with climate and health planning. I'm currently supporting 2 tribes, the Mona Lake Kutsadika in the Eastern Sierras and the Redwood Valley Rancheria in Mendocino County, providing technical assistance. Our work is very much in progress, but I'll just share a couple highlights. I've been with Mona Lake. This is a small tribe that's not recognized by the federal government. And I've been helping Dean Tonena, who's a tribal member and a botanist, and working with Lori at Oweha, who's on the call. Like I said, they're a very small tribe with no full-time staff. And so this climate and health planning effort has been a really big lift for them. And I know they've also worked on applications for some of the sizable climate-related grants that California has made available like the Regional Climate Collaboratives program and the Transformative Climate Communities program. So just wanted to shout out Dean's work and also the foresight of their tribal chairwoman, Charlotte Lang. We've also been supporting Redwood Valley Rancheria, who are working with, they're working with the California Tribal Epidemiology Center to assess population sensitivity in their study area to climate change. So we've supported that health data request that they submitted and using a template that Angie has actually made available on the Tribal Climate Health Project website, and are thinking about how to kind of bolster CTEC's experience. They're very experienced at using tribal health data, but helping them work with climate and environmental data as well to provide that to the tribe. Both tribes are planning to implement community surveys at some point to make sure that their stories and traditional knowledges are incorporated into the planning processes. And both also are interested in exploring multimedia formats like GIS story maps, in addition to kind of the standard written documents. And then I just wanted to share a couple upcoming opportunities. So we facilitate the public health work group of the California Climate Action Team, which holds periodic meetings open to the public, where we bring in speakers to discuss different issues related to climate change and health equity. Our past meetings have covered wildfires and smoke, extreme heat, drought, mental health, active transportation, and other topics, which you can check out on our website. And I just wanted to invite everybody who's here to, we've pushed, we had a meeting planned for August 30th, but it conflicted with NTIC. So we're going to focus on finding a new date in September to talk about tribal climate and health planning. And so you can email this email to stay notified about that. And I'll definitely let Angie know. So the other thing that I wanted to just bring a little update about was two recent changes in the governor's budget that affect our team. One is an infusion of $10 million per year in state operations from the general fund, which is going to be used to initiate a climate change and health surveillance program to provide near real-time notification for public health departments, first responders, and the community for emerging or intensified climate-sensitive diseases. We're also going to figure out how to let tribes that want to get updates opt in, or maybe even tribal health clinics to getting this kind of reporting. This will allow interventions to reduce and prevent further illness. Several other states have programs like this to provide near real-time data. And this kind of surveillance will provide early warnings of heat-related illness cases, and also could provide early detection of health effects from wildfire smoke, climate-sensitive vector-borne diseases such as West Nile virus, waterborne diseases such as Vibrio, foodborne, Salmonella, or E. coli, dust-borne valley fever, and mental health impacts. This is actually going to mean our team will be doubling in size, or more than doubling in size, to add positions to conduct this surveillance work. And then the other new change in budget is we're receiving $25 million in one-time general fund expenditure to this year to establish a climate change and health resilience planning grant program that funds local health departments, community-based organizations, and tribes to develop regional climate and health resilience plans based on public health officer regions, which can then bolster the actions of resource-limited local health departments, communities, and tribes to more effectively prevent and reduce the inequitable health impacts of climate change. There's not a lot of details about these yet because these are fairly new changes, but we'll definitely keep people updated about what these will mean and what we're offering. So now I'm just going to get into our climate change and health vulnerability indicators, or as we call them, CHIVIs. As just a brief history, our program is part of a CDC-funded initiative called Building Resilience Against Climate Effects, or BRACE. And our California-based CalBrace project provides resources and technical assistance for state and local health departments to build climate adaptation capacity and enhance resilience. So we do that through various activities. You can see an example here of our online adaptation toolkit at the bottom right. But one of the other main tools is providing data for assessing climate and health vulnerability. Back when the program started, this was done by gathering various types of data and getting stakeholder input for data products. We created climate change and health profile reports for each of California's 58 counties, but have recently shifted to, in addition to those reports, providing this suite of indicators that can be used at the local level for assessing climate and health vulnerability. These are the chibis that I mentioned. The indicators are grouped into 3 types: exposure indicators, adaptive capacity indicators, and population sensitivity indicators, which are all available at the local level. We made them available on our website via downloadable Excel spreadsheets with documentation and information on the relevance of the indicator to health and climate change. But then I've also created this more user-friendly interactive online platform where users can get maps and data to aid in their own local vulnerability assessments. So that's the tool that I'm going to demo now. So if you go to this link, let's see, I'm just going to switch sharing for a second. And here we go. All right. So what you can do is select your county and just go here. And I just wanted to note, I guess at this point, that there are, as folks probably know, a number of tools for mapping climate impacts and vulnerability in California, including Healthy Places Index, which I believe was demoed to this group recently. There was a report by the Asian Pacific Environmental Network that assessed a variety of these tools and selected Chivi's and HBI as 2 of the 4 best for scope and quality of these tools. So we do see them as kind of complementary and high quality tools for you to use. So you select a county, and then you can go to the county snapshot. Oops, let me just reload. I think this is, oh, there we go. So you can go to this county snapshot. There we go. Just took a second to load. And see the county compared to the state average on a number of different metrics. You can see that indicators that are higher than the state average will be at the top, and ones that are lower will be at the bottom. You can also see a map of each single indicator by census tract. So here, just give it a second to load. And you can see here, this is, I believe we have, the example is the percent of the population age 65 and over, but you can also choose other indicators, a drop-down menu, and then scroll down to see the comparison to other counties, as well as the indicators by race groups and the most vulnerable places in the county listed out. If you have your tribal boundary layer, then you can kind of see that overlaid with this variable. And then finally, there's this vulnerability tab where you can take an exposure indicator and a sensitivity indicator and actually see where your county is kind of shown against the other counties in the state. So here, what you can see is, for example, showing vulnerability based on both kind of projected extreme heat days on the x-axis, and then on the y-axis, we have population over 65. So blue counties have a lower vulnerability on both factors, and I'm sorry, orange have a lower vulnerability in both, and purple have a higher vulnerability in both factors. And you can just use this menu to click other indicators. Okay, so with that, I will stop sharing and switch back over. How are we doing on time? 4 more minutes?
Yeah, 4 more is fine. Then
Great.
we'll have time for discussion. Yeah.
Okay, great, thank you. Okay, let me just finish up with my slides then. All right. So this tool is built using R Shiny, and it's a living resource that we have many plans for to make improvements and expand the data provided. We'd like to add health outcomes, for example, as well as more data on exposures such as wildfire smoke maps. It's been pretty well received by stakeholders in the state. It's been used at this point for local and tribal vulnerability assessments. It's been added to state climate change grant guidelines as a suggested resource that applicants can use to assess and demonstrate vulnerability. For example, there's a picture here of one of the California climate grant programs, the Transformative Climate Communities Grants, TCC. It's been used in other statewide plans and policies, such as helping in defining the most vulnerable populations to wildfire in one of the state's wildfire reports. And chivvies have also been added to other data platforms, such as the state's Environmental Public Health Tracking Network data platform and the Healthy Places Index, which you saw in a previous session. Some of our lessons learned just from building this tool out. We found R Shiny is pretty flexible and worked well for our staff. Didn't want an outside web developer, but we still have a lack of staff and time to make all the changes we'd like to make. We basically have one epidemiologist who's updating it right now. The data tends to get out of date fairly quickly. It needs to be updated often. As with most public health data products, some areas and populations are difficult to find data for, such as tribes and in rural areas. And there are, like I mentioned, many tools out there. So it's a challenge to balance not wanting to recreate the wheel, but also offering our stakeholders what they want. And finally, we have not done what HPI has done, which is create one overall indicator or index of vulnerability or health. That is something that seems very useful as a communication tool for stakeholders, but there are also some, I think, methodological and resource challenges to that approach. Thank you so much, everybody, and feel free to email me if you have more questions or bring them to me now.
Thank you. It's actually, we work with you pretty closely, but it's nice to just kind of see it all put together and see the plan in action. So thank you for that. I'm going to open it up to questions. So, we'll look at this from a tribal perspective. What questions do you all have?
I have questions and comments. First of all, I love this because it seems very straightforward and easy to interpret. Which data can sometimes not be. And I like the census tract overlay because especially, it doesn't always allow you to pinpoint tribal communities, but it can be very helpful in that way, especially a lot of the weather and climate specific data about heat days and things like that. That makes it a little bit easier. Yeah, I think this is really, really good. And I'm gonna make sure that this recording today is highlighted for some of my tribal colleagues, because I think they will also want to take advantage of this tool. I wish there was somebody here from another state so I could ask if any other state has something similar. But I wonder if they were to ask you, let's pretend that I'm from North Carolina. Is this something that would be simple to say, here's what we did and you can do it too?
I think that, I think building it in R is definitely advantageous if you don't have a lot of money for a big contract, which then every time you need the platform to be updated has to be re-upped. So I think if other states have the kind of know-how on their teams to do it themselves, it can be a lot more flexible and more affordable for them. I can definitely, I think that's a really good question about is this methodology duplicable that I can put to our epidemiologist to see if she's had other states reach out to her to ask her how they can do it themselves, or if she took inspiration from other states and what they have. I think I generally assume that California has the most advanced DIY approach to climate and health, or just the most robust. But I would be really interested to see if there are other examples of these kinds of kind of state-maintained platforms. With HPI, for example, I think it's a really helpful point of contrast in a number of ways. So I mentioned they have that kind of combined indicator, which I think can be really useful and also can be a little bit of a black box when you're actually wanting to know which specific variable is having the most impact on like why an area is designated in a particular way. Our tool also focuses specifically on just climate related impacts, and I find HPI, really impressive, but also a little overwhelming sometimes, in that there's just so many layers to choose from that it can be a little bit paralyzing. And so I think for a tribe that doesn't have a lot of orientation to this topic, that we hope that Chivies can be that for them and help them kind of prioritize amongst the different climate hazards. And I'd love to know if there are ways people think that we could continue to improve it to make it even more intuitive. Is that?
That helps. I mean,
Yeah.
I'm thinking about many different things. I'm thinking about, like you said, the Healthy Places Index, and about CDC Brace, and all the different things that are available and that can be overwhelming, or the links that we have in the easy tool. But what I would also like to see is just an overall list of, these are all the different places that you can go for data without necessarily having to first go through the tool and then say, this is something I'm concerned about, and then this is a tool where I can learn more about it. And then there's so many that might be, like you said, duplicative. I'm also just fantasizing about how I'm going to help the federal government spend the Inflation Reduction Act money, because I have ideas. I think we all have ideas. So that's what I'm thinking. And, final thing, because I see Lori has her hand up, is thinking about our California tribes who have ancestral landscapes and also reservation lands that are cross-border, like CRIT, for example, Colorado River Indian tribes, and how it would be useful if Arizona and Nevada had something like this, so you can see what's going on both sides. Lori, go for it.
Thanks, Osama. First, I just want to say you're such a wonderful and lovely guy to work with, and I really appreciate. I'm so glad that I met you. I love this tool. It's very cool. Do you have any problem getting folks who know R? At WEHA, we're pretty old, and so very few of us know R. It seems like all the kids know R, but we oldsters just know Excel. Has that been a challenge?
Yeah, I mean, I personally am not. I'm just getting back into R. We took a little bit in grad school, and I think they try to push it more now because it is free. I think that I wish Serena was still here, because we could talk about that. The training that we just did was all in R, and it seems to be a direction that the different train the trainer type programs out there are starting to emphasize, just because unlike ARC GIS, it's not pay to play. I do think that I've found that, surprisingly enough, the tribes that we work with actually have a pretty high level of GIS expertise, and also, or maybe not surprisingly, and also have licenses to ARC Pro and ARC Online and things like that. So I do think that I personally am trying to think about how can we make this process, if you are working with a tribe that has a higher tech capacity, that they can just take the data and bring it over into whatever platform they're using. So assuming that they're using maybe one of the ARC programs, they can take the data, add their tribal boundary layer onto it, and then really just plug that right into their plan. Another thing that I'd like to do, just in thinking about how to make this an active resource for tribes, is starting to adapt our CalBrace resources and page which is oriented at local health departments, to be more reflective of tribal plans and tribal action on climate change, and give some examples of that. And Angie's been a really helpful thought partner for that, and kind of feeding me some different examples of tribal plans and tribal action. But I think, it's this question ever since the summit, the Paula Summit. I think I've been thinking a lot about, what does the data to action pipeline look like, and how do we not let the burden of data analysis overwhelm our tribal staff, who sometimes have limited time and capacity to engage in these topics. So if it's just one thing that results out of this, they say, oh my gosh, look, we're in the counties most vulnerable to heat in the state, that they can then just pick some kinds of priority actions to protect the elderly. They can go sign up for, once it's stood up, our syndromic surveillance data, so they can get alerted to when there's heat events happening, and maybe use that to inform their buddy check programs for elders who live alone. So I think that's something I've been thinking about, is just how do we make sure that this is a tool that leads to action.
And my other question is, you talked about the challenges of updating. If I emailed CalBrace, because I know for Cal and ViruScreen, we get a lot of people that notice errors in our data, and I really love that. If I emailed you tomorrow and said, here's an error, or here's data you're missing, how long realistically does it take to fix that?
I think we're actually pretty, like I said, because we have Meredith, the epidemiologist, on staff, and she's constantly updating we have different profiles that have like a written description of the different variables and why they're important to health, because she's constantly doing that and is in there. And just the other day, she was like, oh my gosh, Chivies isn't working and I need to go fix it. I think it's actually a pretty speedy process. Like, we're talking like months relative to a change. If you notice a change in HPI, maybe they have time to address it in their current, in their different revisions, but it might, take a whole nother cycle of updating the program.
Months is the speed?
I would say, yeah, I could ask.
I was just curious.
Yeah, because it's not me doing it, I wouldn't want to say exactly how long it would take Meredith, but like not long. Yeah, Isabel?
Yeah.
Yeah, I'm really interested in the syndromic surveillance. How would we find out more, and specifically, how would we find out what exactly surveillance is going to consist of? What are the metrics? What are you going to be looking at?
Yeah, so we don't know a lot of the details yet, because all of the people who are going to be the syndromic surveillors need to be hired. I think we're assuming that it's going to have feed into BioSense, the CDC, the National Syndromic Surveillance Program, and some emergency departments in California are already reporting to BioSense. So I think we'll have to figure out how to basically have staff working with the emergency departments that are not reporting right now. I imagine also, Isabel, I know we've talked in the past about the list of kind of coding climate related illness. And I think that's not something that's been standardized at this point. So we'll definitely be a part of the process as well, I'd imagine, is trying to figure out what is the kind of like master list of all climate related codes that we're looking out for and that get flagged as a part of the reporting. But I'm really not supposed to do too much guessing because it's so brand new. I mean, we just got assigned the funding in July, basically. And so we're like, oh my God, the team's going to double in size. Like that's, and we need to, figure out how to run this whole program and not make it overwhelming for emergency departments. So I think lots to be figured out still.
It's awesome. And it's emerging for me is how clear these two buckets are that are necessary when we talk about data access, right? So there's this, for tribes or anybody, data access that's so important. A lot of what we focus on has been in the planning process. Like, how do we get the trend level data to understand how we can plan ahead for strategies? But then there's this other side of that data access, which is real-time surveillance data. It's really more in it's like post-planning, it's action. It's part of adaptation in action. And I like having those two buckets in my head as both being critical, and that Tribal Climate Health Project probably needs to focus its attention, not just on the planning, but on helping data access in real time so that tribes can move and act when they need to. But, in full transparency, we're going to be working more formally with CDPH, and we have lots of time to kind of think up these things and work with you. And I'm excited about that. A few more thoughts. So just the thing that always pops up in these meetings every time we talk about a tool, right? It's always tribal boundaries. I know you know that, right? So like at some point you probably are thinking about how to map in tribal boundaries, but like Shasta said, it's complicated, right? Were you there when we talked to University of Washington, the tribal tool? Yeah, the tribal climate tool, right? How much work they did to try to figure out all the variations of boundaries tribes have in the Pacific Northwest. So complicated. I don't expect you to have an answer on it, just mentioning it. Indigenous science has been coming up more and more for us when we talk to tribes, just wanting to know where is the underlying data coming from, and how did traditional ecological knowledge fit in? Is there any indigenous knowledge that's part of that data? When we talk about historical, are we talking about historical in a tribal context? How far back does that really go? And then I'm so glad you're talking about outcomes already. I'm interested in the outcome data, right? Like a health department, I feel like what this tool adds to the ecosystem of data, because we have other places to go for exposure data and theoretically even population sensitivity and adaptive capacity, but it's the health outcomes. So like, do you guys have in mind a process for how you will select what health outcomes you're going to focus on providing?
I don't think we have a process described yet, but I would really love, as we're starting up work with the Tribal Climate Health Project, to consult with you and Shasta about that process, and how much input to try to gather on it. I think I don't know how technically feasible it is, but it's really exciting to have the syndromic surveillance coming online. And I think there's going to be hopefully that kind of wealth of data will also give us more options in terms of what kind of health outcomes we could show in something like these. I do want to double back to the tribal boundaries point and just share a recent conversation that I had with one of Lori's colleagues at OEHA, who has been a part of the decision to add tribal boundary layers to the state's disadvantaged communities map system. And I know I emailed out about how Cal EPA has this new process by which tribes can kind of take a look at the tribe, because all tribal reservations are shown on the disadvantaged communities map currently, but there's a number of different kinds of lands that are not, the federal government may not be tracking, that tribes have ownership over. And so we know that is something that some would prefer to see on there, some don't want to see on there. And so I think it's nice that Cal EPA is offering this kind of more flexible way to get your land shown if you want them shown. I think it tends to be that CDC, I'm not CDC, I'm sorry, BIA and CDC have both been a little bit more hesitant to show tribal boundaries alongside health data and as a layer, just because of historic sensitivities. And I think, but from what Lori's colleague was able to share, it sounds like California tribes didn't have the same kind of pushback against the idea of having the tribal boundary layer on the website. And I don't know why it is necessarily, but Lori, maybe you have more that you can share about that whole process if you've been party to it.
I've just been party to pushing it when they decided that they weren't going to do it at all. And so I kind of had a little internal hissy fit at OEHA, and it worked. But I was wondering if you're part of the Tribal Boundaries Working Group, or if Shasta or anybody else is, are they considering including historic lands? Because I know that many tribes still inhabit, gather on, or attached to historic lands. And has anybody considered doing boundaries in a more flexible way? I mean, I'm used to, my property ends and your property starts, but with lots of tribal communities, there's land and you're in this land, and sometimes we're in it together, sometimes we're not in it at the same time. It's a much more flexible, historically at least, view of who owns the land.
Yeah.
And are they considering having that more flexible, realistic view?
So first of all, I didn't know there was a Tribal Boundaries Working Group at the national level, and boy howdy, I would go in there wearing full body armor if I was a part of that. Yeah, because people gonna get stabbed. But for us, yes, I think it's important to have ancestral landscapes included, but the thing is that ancestral landscapes aren't under tribal control. And we can consult about those, but we can't do anything, really concrete when it comes to this stuff. What matters as far as our adaptation planning is where the people live and what we are able to do on our own, whether it's through tribal funding or with assistance from the state or the federal government. And of course, for those tribes that don't have trust lands, that's another issue entirely, because they still care about their communities and their tribal members, but they have to work within the areas where they live. And then there's also, of course, scattered. I mean, we have tribal members living all over the world. But my concern is for the community of Paula specifically. I think it makes sense for there to be reservation boundaries, because that's public information that anybody can find very easily. But ancestral boundaries, and we've talked about this before, it's contentious. Hence the body armor comment. There's continuous, in my experience, debate over where those boundaries are. But just again, purely from a data and planning perspective, the most useful information is going to be for those areas over which we have some control. And if you want to expand that a little bit, then it would be good to have the inclusion of things like traditional gathering areas, like the oak groves that we collect from in Palomar State Park, or the mesquite beans down near Scissors Crossing, going down into the desert. And those are obviously not tribal trust lands, but they're state park lands that we've gotten access to. And that's something else that's important. So like, we're trying to plan a mesquite harvest right now. And it's a combination of, first of all, knowing when the beans are ready to harvest, and choosing a day where you're not going to instantly burst into flames the moment you step out of your car. And that's kind of the thing that's stopping us right now, is it's so incredibly hot. And so from a health standpoint, we got to be able to say, okay, this is mesquite gathering day only for people under 50, or who don't have underlying health conditions, where the heat is going to create, significant health issues for them. But that starts to be, a larger thing for us to have to plan for when we're talking about our mitigation strategies for, the health impacts of climate change, both on a long-term level and on a very specific, who's going to survive the mesquite harvest kind of level.
I want to make use of having Patricia here too, before we have to close out. Especially, I'm thinking, like, there's obviously huge connections to what you're working on, and there's tribal advisory group. I'm just wondering, is there a way to leverage that group to help answer some of these questions around what tribes need?
Yeah, I think so. I think those are exactly the kind of questions we're going to be working on with the tribal advisory group. And we are thinking, like, what are our regions going to be for the 5th climate assessment? And how do we incorporate tribal lands or don't? in a respectful way. Those are all things that we hope the tribal advisory group can weigh in on. And while it's just with the 5th assessment now, obviously we hope that that impact kind of expands further. There's so many tools out there, right? There's so many assessments. There's so many, I think in general, communities are being bogged down by the quantity of different tools out there. So we're also trying to identify what's out there, so we're not recreating the wheel, right? We're not the health experts. So really trying to make sure that we're filling the gaps where they need to be filled.
Yeah.
Yeah. There's a lot of
Keep
questions.
coming to these meetings, because that's what, like, all we talk about.
Yeah, no, already I'm just like, oh, I know we need to ask that. This is what yeah. But our first step really is, before we get too far ahead of ourselves, is standing up that tribal advisory group. So
Yeah.
for us, that's the first thing that we hope to happen before we start asking these questions. So we really want it to be tribally led.
Yes.
As close to being tribally led as it can be being a state program. Understanding that.
Patricia, I know that we're over the time, but I'm wondering if you could say a little bit more about, are there any members of that designated already, or is it kind of a selection process? Like what's the process that you're using?
Yeah, we're doing a nomination process, and it's pretty flexible. I'm just asking for a resume or bio or a little blurb about the person being nominated, and self-nominations are acceptable, but then a recommendation letter from a tribe. So making sure that key individual is being recommended from a tribe. Right now we have a tentative deadline for September 9th is when we were going to close nominations. So as long as we feel like we have gotten the word out successfully, we'll stick to that date. And we're really looking for, definitely folks with expertise in traditional knowledge, youth and elders, or at least those with connections to that, under a broader understanding of what that means when we're incorporating TEK into, state policy and reports and things like that. Climate expertise, which could be anything from economics to health. And then once we have that group stood up, we'll be meeting on a regular basis to kind of move forward the tribal research program, as well as inform kind of the greater 5th assessment when we're making some of these decisions. How are we considering regions, or what are our research priorities? So all of those decisions we're making kind of broader in the 5th assessment. We'll be discussing with this group as well.
I'll be nominating myself, and I'll be writing the
Great.
letter, or the recommendation letter for chairman to sign for myself.
Hey, if he signs it, I'm.
That's what he'll do. I'll say, I need a recommendation letter. He'll say, okay, write something and I'll sign it.
Yeah, I've definitely been there, so I get it. Yeah, I mean, Shasta, and you were involved in the 4th assessment, and this is where the program really was built from. The recommendations that came from the 4th assessment is what this team was built, or this vision of this program was built from. And I think we have flexibility moving forward on what it looks like. So I think getting the right folks on that tribal advisory group really can help form that. And then I don't want to say the state in general, but a lot of people are talking about, how do we respectfully and meaningfully consider traditional knowledge and tribal expertise into state work, and it could be very meaningful, lasting work, I think. So yeah.
Well, we're so glad you decided to join us.
Yeah, thanks for letting me crashing.
Yeah, and Asamu, at some point, what I want to hear more of is your experience actually helping to write these adaptation plans and vulnerability assessments. Like, what are you learning? Like, because that's where the whole easy tool came from, is me actually sitting down to write a vulnerability assessment, be like, like there's a lot of missing things that I need to translate the actual risk to these communities. So I'm sure you're seeing the same thing. So I'd love to hear more. I don't know if you're, my last question, I guess, is, are you tracking that somehow? Are you like keeping your notes about things that don't exist that you wish existed?
Yeah, definitely. I think even some of the things that do exist, but then we had to go get them from somewhere else. So for example, we recently learned that there's a really great HABs, harmful algal blooms tracking program in Lake County around Clear Lake, and they've done some work to create technical resources. And that's just another project at CDPH that I just hadn't learned about yet. And so I think it'll be really valuable for our Redwood Valley Rancheria plan to be able to take a look at that and say, oh, this is really helpful thinking that they've done about what are, how do we talk about water quality to a tribal audience, and, about the dangers of eating fish and shellfish that have been contaminated with nanotoxins, but, it's still, I think, important to some people to harvest. So, yeah, absolutely. I would love to have a future session where we share some of those ideas.
Cool. All right. Let's think more about how we talk about all this. But let's wrap up for today. We don't normally go over, but this has been so good. I love California. I do. Thank God I'm here. Ben, just come to California.
You're gonna love it until you turn on the tap and just a puff of dust comes out.
Yeah, oh yeah, that's true. That's true.
I'm in California. I'm just stuck working in Nevada for the time.
That's right. That's
being.
right.
But if anyone wants to hire me,
come to the dark side. All right, you guys, I'll let everybody go. Thank you so much for such a good conversation. And Salma, I really appreciate your presentation. Come back next month for HHS. We'll hear about this on a federal level.
Thanks, you guys.
Bye, everybody.
Bye.
everyone.
Thank you.
Thank
Great
you.
work,
Thank
Osama.
you.
Great day.